Thank you, Bob. Thank you, Eyecelerator, for this opportunity. So the few speakers before me kind of set the ground for an eye drop, so that's actually pretty good for me because we actually have clinical data. Just to introduce the three clinical programs that Oculis is running today, the OCS-01 is the most advanced with phase 3 studies going on, and the topical intervention, the most advanced eye drop for the treatment of DME. The way that we are thinking this as a couple of segments in the population, it's early intervention for patients who are diagnosed with DME but not yet treated, and for those who are inadequately responsive to anti-VEGF and current therapies. The second program here is like a Limlab OCS-02, which is the genotype-based development, and I'll just plug in an ARVO poster that you can check out later this week. The really interesting here is it's a personalized medicine, it's genotyping, and it's more targeted to those patients who are actually more likely to be responsive. And then the third is Privosegtor OCS-05, neuroprotection. This was a study that we publicized earlier this year, showed good data in both structure and function and potential to be the first neuroprotection for acute optic neuritis and other indications later on. So diving into DME, we had already 4 studies with data showing the eye drop is actually effective and safe. As a potential, an actual patient on the right-hand side is showing from our phase 2 study, a patient that was treated for 12 weeks, presented with the diagnosis of DME but not yet treated, with over 760 microns on OCT and about 40 letters in BCVA. After 12 weeks of treatment with an eye drop, the CST reduced to about 300 microns, and BCVA improved by 16 letters. And here I'll show you the rest of the data for our stage 1 DIAMOND study that was completed last year. BCVA ETDRS from baseline at 6 weeks was 7.2 from baseline in the OCS-01 arm compared to vehicle arm. And on the right is the BCVA change from baseline at 12 weeks. The primary endpoint for that study was 6 weeks. We also looked at the percentage of patients who gained 15 letters or more, and as you can see consistently, the OCS-01 patients were 25% at 6 weeks and 27% at 12 weeks at baseline, from baseline. In terms of anatomy, we also see consistent results as soon as 2 weeks after baseline. Again, this is the eye drop only, and consistent all the way from 6 weeks all the way through 12 weeks. And we also, the study enrolled both naive patients and previously treated. As you can see, this is consistent across those 2 subpopulations, both in BCVA and in CST. In terms of safety, there are no unexpected AEs, no related SAEs, and in terms of the IOP, the patients who experience IOP, about only half of them needed an IOP-lowering medication, and none of them needed to discontinue from the study. And so the DIAMOND program continued to the phase 3, the 2 identical well-controlled studies, and we're happy to report that those studies completed in rapid time with a very experienced sites and excited patients to participate. We enrolled both naive patients and previously treated who were inadequately controlled. And the primary endpoint is BCVA change from baseline to week 52. We used a single drop 6 times a day for the induction phase of 6 weeks, followed by a single drop 3 times a day for the rest of the study. And so Oculis is well positioned to advance those 3 programs that I mentioned. The OCS-01, that's going to be the first eye drop to treat a retinal disease, the OCS-02 in dry eye disease, and OCS-05 in acute optic neuritis, expand with OCS-05 into neuro-ophthalmology and beyond, and explore other indications in the future.
Fantastic, really interesting work. Exciting to see really responses of patients. And unlike my NPDR patients, DME patients definitely see a benefit, a visual acuity benefit when they're treated. Help me understand in the clinical setting, any restrictions, how these drops are like used, or can it be at room temperature, any kind of logistical aspect of it?
Yes, exactly. That they can be room temperature, and there's really no issue. The patients like it a lot. We have repeat sites that wanted to participate after they participated in previous studies, and they wanted to introduce this to their patient base and participate in our studies in the phase 3. So the patients really like it.
It's really great to see this level of improvement with just a drop. I'm wondering for long-term utilization, what you think the cataract risk is and the pressure risk. I know in short term it was fine, but what do you think about long term?
Yeah, so remember these patient population, DME patients, a lot of them will require cataract surgery anyway. We haven't seen those in the previous studies. Granted, the stage 1 that I showed you was a shorter duration study, so we haven't seen cataract surgery or cataract progression as an issue, and we're certainly monitoring this in the phase 3 study. In terms of IOP, as I mentioned, there are some patients who are going to be steroid responders. Most of these patients are well controlled with IOP medications, with IOP lowering medications, and if they need to do a drug holiday, they can do that and then go back to the drug.
Great. Thank you very much.
Thank you.
Appreciate that.